Introduction. Welcome, medical students, to today's lecture on tyrosine metabolism. In this comprehensive script, we will delve into various aspects of tyrosine biosynthesis, hydroxylation, catecholamine synthesis, melanin synthesis, thyroid hormone synthesis, tyrosine aminotransferase, tyrosine degradation, alkaptonuria, tyrosinemia, tyrosine kinase signaling, neurotransmitter metabolism, and phenylketonuria, PKU. By the end of this lecture, you will have a deep understanding of the intricate processes involved in tyrosine metabolism and its relevance in human health. Let's begin exploring these topics in detail. Tyrosine biosynthesis is a critical pathway in the synthesis of various essential biomolecules. It starts from the amino acid phenylalanine, which is predominantly derived from dietary sources. This conversion occurs through the enzymatic action of phenylalanine hydroxylase, catalyzing the hydroxylation of phenylalanine to tyrosine. This reaction requires tetrahydrobiopterin, BH4, as a cofactor and molecular oxygen as a substrate. Additionally, defects in the phenylalanine hydroxylase enzyme may lead to phenylketonuria, a condition we will discuss later. Once tyrosine is formed from phenylalanine, the next crucial step is tyrosine hydroxylation. This process is catalyzed by the enzyme tyrosine hydroxylase, TH, which adds a hydroxyl group to the phenyl ring of tyrosine. TH, like phenylalanine hydroxylase, also relies on tetrahydrobiopterin, BH4, and molecular oxygen. This hydroxylation reaction plays a vital role in the synthesis of various neurotransmitters and hormones. Tyrosine hydroxylation serves as a precursor for the synthesis of important catecholamines, including dopamine, norepinephrine, and epinephrine. After tyrosine hydroxylation, the enzyme aromatic L-amino acid decarboxylase converts L-dopa, 3,4-dihydroxyphenylalanine, into dopamine. Further enzymatic transformations lead to the formation of norepinephrine and subsequently epinephrine. These catecholamines play crucial roles in the nervous and endocrine systems, regulating several physiological responses. Another significant pathway utilizing tyrosine is melanin synthesis. Melanin, the pigment responsible for skin, hair, and eye color, is synthesized through the enzymatic actions of tyrosinase and other related enzymes. Tyrosinase converts tyrosine to dopaquinone, which undergoes further enzymatic reactions to produce eumelanin or pheomelanin. The balance between these two forms of melanin influences the variations in human pigmentation. Tyrosine also plays a pivotal role in thyroid hormone synthesis. The thyroid gland synthesizes and secretes two key hormones, triiodothyronine, T3, and thyroxine, T4. These hormones contain iodine atoms, which are incorporated into tyrosine residues within the thyroglobulin protein. Through a complex series of enzymatic reactions, iodinated tyrosine residues are combined to form T3 and T4, which are crucial for regulating metabolic rate, growth, and development. Now let's shift our focus to the enzyme tyrosine aminotransferase. This enzyme, also known as tyrosine transaminase, facilitates the transfer of an amino group from tyrosine to alpha-ketoglutarate. Through this process, tyrosine is converted to p-hydroxyphenylpyruvate, which is a pivotal intermediate in tyrosine degradation. Tyrosine degradation occurs through a set of enzymatic reactions that convert tyrosine to fumarate and acetoacetate. The initial step involves the conversion of tyrosine to p-hydroxyphenylpyruvate, as mentioned earlier. Subsequently, p-hydroxyphenylpyruvate undergoes further transformations, leading to the formation of homogentizate. This intermediate is then metabolized into fumarate via the homogentizate 1,2-dioxygenase enzyme. Deficiencies in any of the enzymes involved in tyrosine degradation can result in clinically significant conditions such as alkaptonuria and tyrosinemia. Alkaptonuria is an autosomal recessive disorder caused by a deficiency in the homogentizate 1,2-dioxygenase enzyme. This deficiency impairs the breakdown of homogentizate, leading to its accumulation in the body. Excess homogentizate is excreted in urine, which upon oxidation turns dark upon exposure to air. Additionally, the accumulation of homogentizate can cause joint and connective tissue problems, leading to arthritis-like symptoms. Tyrosinemia refers to a group of inherited metabolic disorders resulting from abnormalities in various enzymes involved in tyrosine metabolism. These deficiencies can lead to the accumulation of toxic intermediates, such as tyrosine and its derivatives. The specific symptoms and severity vary depending on the enzyme affected. Early diagnosis and prompt treatment are crucial to prevent severe complications, including liver and kidney problems. Moving away from metabolic pathways, tyrosine kinase signaling is a vital regulatory mechanism in cellular communication. Tyrosine kinases phosphorylate specific tyrosine residues in target proteins, altering their activity and initiating signaling cascades. Dysregulation or mutations in tyrosine kinases are associated with various diseases, including cancer, diabetes, and autoimmune disorders. Targeting tyrosine kinases has become a promising strategy for therapeutic intervention. Tyrosine metabolism is closely intertwined with neurotransmitter synthesis. Catecholamines, as we discussed earlier, are essential neurotransmitters involved in neuronal communication. Regulation of their biosynthesis, release, and degradation is critical for maintaining proper neurotransmitter levels and functionality within the nervous system. Imbalances in these processes can lead to neuropsychiatric disorders such as depression, anxiety, and Parkinson's disease. Lastly, we come to phenylketonuria, PKU, a well-known metabolic disorder linked to tyrosine metabolism. PKU is caused by a deficiency in the phenylalanine hydroxylase enzyme, which impairs the conversion of phenylalanine to tyrosine. The subsequent accumulation of phenylalanine and its metabolites can lead to severe intellectual disability and other neurodevelopmental issues. Early diagnosis through newborn screening and dietary interventions are crucial in managing PKU. In conclusion, the pathways involved in tyrosine metabolism encompass a wide range of physiological processes and hold significant clinical relevance. From its biosynthesis, hydroxylation, and various downstream pathways to the resulting disorders and regulatory mechanisms, tyrosine metabolism represents a fascinating field of study. This comprehensive knowledge opens doors for potential therapeutic interventions and improved understanding of human health and disease.